Alright, so today I'll be doing my final presentation over pain assessment and reassessment. So why did I choose pain assessment and reassessment? So I originally got the idea because I'm working at Nebraska Medicine on the 8th floor of the Clarkson Tower, which is a cardiac progressive care unit. There, Many of the patients have moderate to severe pain. A lot of them are just getting out of surgery, so they have a sternotomy, which is like the separation of their sternum for the procedure. They have a lot of heart and lung transplants, so a lot of them are having a lot of current pain. And even what gave me the idea originally was that there were nurses on my floor during the nurse residency project on the same thing. And obviously with nursing, one of the first things you do when you enter a room after your bedside report is you ask if they're in pain or if you can do anything for the pain. So during this research, I hope to learn a lot more about pain assessment and reassessment, different populations that handle the situation differently, if there's any discrepancies with a different population. So in my paper, the intro, it explains the three main points, which is the current research and effectiveness of pain assessment when looking at the trajectory after surgery. So obviously, you expect them to have a lot of pain right after surgery, and then it'll gradually decrease as more pain interventions are done. Next topic would be the pediatric assessment, and then the next would be the geriatric assessment and reassessment. Because each of those categories have discrepancies with both of them. Obviously, it's harder to get that subjective information from those two populations. And then I will also be including information from my interview with Nico Caban. She is the nurse, one of the nurse leads on my floor. She's my supervisor, so she was a great person to interview. So in my first paragraph, I do my research question, which is, how does pain assessment and reassessment benefit the patient? Is reassessment of pain truly necessary? And are there any discrepancies with performing an assessment-reassessment of the pain? The Joint Commission, I believe it was back in 2003, mandated that all nurses must do a pain assessment and then chart on it after. And then in 2009, I believe that they made sure that nurses are doing a reassessment and asking the patients after the medication or after the intervention has had time to work what their pain level was at. So for my second body paragraph, so I go into the pain trajectory. This article talks about how 146 of these patients had surgeries. They had moderate to severe pain. All the nurses that took care of them, or most of the nurses that took care of them, asked them about their pain prior and then after. And actually in the results, I believe it was 95% of the nurses did the pain assessment and then reassessment after. Only one didn't check for reassessment after. And all their pain, like I said before, it started high after the surgery and then progressively went it went lower and lower and lower until they were discharged. The third body paragraph I had was about pediatric nursing. So obviously, when working with a much younger adolescent or say even an infant, they don't have the cognitive ability to say I'm in pain or say that, or just describe the pain that they're having in general. So nurses have to find other cues in order to tend to their needs. And it just really shows the subjectivism that pain is, that one person might say, oh, it's 10, and the other person might say, oh, it's 2. In the pediatric nursing, there was found that the highest rates of nursing, highest rates of asking for assessment and reassessment were done in this category, and also the types of pain tools that were used. So a lot of times they use like the faces, like the frowny face and the happy face for like a 0 to 5 scale or 0 to 10 scale. When there was on my floor, she had not worked in pediatrics, but she had a rotation with it. So she pretty much gave me the same information that I kind of thought before, that you have to interview them more, use more physical gestures, and and then at times if they're older adolescents, try to get them alone in the room so that the parent isn't influencing their decision. They should be doing it basically all on themselves. And then my fourth paragraph is geriatric nursing. And geriatric nursing, can be struggles because obviously the patients are older, they can be hard of hearing, their cognitive ability might not be as what they used to be. So that's also a challenge found. In the study that I did, they did, I think it was over 50,000 admits to an ER in an urban emergency room, and all the patients had moderate to severe pain. And in this instance, there was, I believe, I'm not sure what the percentage right off my head is, but I think it was maybe a 30% decrease in pain that went from a scale of 4 or lower in this category. And obviously, my supervisor, the person I interviewed, most of the people on our floor are geriatrics or of older population. So firsthand, she knows the effects that these narcotics and other analgesics do to older adults. They have a greater effect. So, and there's also a higher chance of delirium with anesthesia. So she's very careful when she does the pain assessments and makes sure that they know what is going on and what they will be receiving. And to conclude this, pretty much go over what I did before, my 3 main points about the trajectory of pain, geriatrics, pediatrics. Pain assessment is some of the top priority when it comes to nursing. That's one of the first questions when you enter the room. It's one of the last questions when you leave the room. So it's really important that nurses are making sure that they're doing that first assessment, of course, but especially that second assessment, because we really want to know if we're helping them at the end of the day. And there's not a ton of research over reassessment, but as time goes on, I'm sure it will keep on going and more fields will be introduced in this. And that concludes my presentation. Thank you.